We will be discussing the case of Mary and identifying actual and potential problems with reference to the quality use of medicines and discussing management options. To support this, we will be providing a therapeutic and healthcare plan in an attempt to help Mary manage her current condition. Potential problems are problems that a patient may develop given their particular circumstances and health status. 47-year-old Mary is at risk of developing potential problems such as weight loss, anorexia, fatigue, immobility, anxiety, lack of concentration, and continued depression. The potential drug therapy problems with a given scenario are found to be that the prescribed medication or non-medication therapy is inappropriate for Mary's particular medical condition. Her current therapy regime, duration, and dose is also inappropriate. Moreover, there are clinically significant drug interactions, and it is clear that Mary is not receiving the full benefit from the prescribed medication. Actual problems are the patient's problems that already exist. In the given scenario, the actual problems Mary is faced with are depression, anxiety, asthma, joint pain, and sleep disturbances. There is evidence to suggest that Mary's safety is compromised as the new medicine is causing medical problems and interfering with necessary or desired activities of life. The scenario further suggests the medicines are ineffective in that the desired effect is not being achieved. Mary is not functioning to a higher level on her current medical regime, and adherence to her medication presents as an actual problem as well.
Quality use of medications, otherwise known as QOM, is a framework used by health professionals to help determine how to use medications both effectively and safely. This strategy also ensures the patient fully understands the medication they've been prescribed and how to properly use it. The structure of QOM is divided into 4 elements, which are listed as judiciousness, which is the consideration of the place of medicines in treating illness and maintaining health. Recognition that non-medicine therapies may be the best treatment option considered for a certain medical disorder, which will stem from judicious decision-making. Applying judiciousness for Mary's case will include therapeutic management of her medications, the self-management of her medication, if the prescribed medication is appropriate for her, and if her side effects are compared to benefits when the medication is taken. To ensure the appropriateness and best option of medication for the individual, the clinical condition, the risk factors, the dosage, monitoring, and the length of treatment should be taken into consideration. Deciding whether a medication is appropriate for Mary's case revolves around her patient history, the route, drug interactions, availability, and cost. Safe and effective use of medications means to ensure the best possible outcome of therapy, which occurs by constantly monitoring outcomes and minimising misuse, overuse, and underuse of the drug. It also means improving the ability of all individuals to take appropriate actions to resolve medication-related problems. In the case of Mary, the points that need to be taken into consideration are patient knowledge, the dosage, which is to check both the prescribed asthma puffs, which is 4, and to check prescribed fluoxetine, which is 4 milligrams.
To resolve the actual and potential issues identified, a range of management options were devised. The most immediate concern for Mary is resolving her depression and anxiety. Additional problems include her asthma, which has the potential to negatively affect her levels of depression and sleep patterns. The final issue for her is joint pain. Mary's main issues of concern is her depression, which has been causing her anxiety, disturbed sleep patterns affecting her mood, and causing a decreased appetite. Healthy coping mechanisms, along with stress reduction, should be applied to Mary's lifestyle for her anxiety to be reduced. The goal of non-pharmacological therapy is to control symptoms while improving individuals' social function. Significant lifestyle changes are necessary, such as quitting smoking and drinking, which increases her anxiety, as well as reconsidering a change of job and socialising more. Additionally, Mary's asthma has the potential to negatively affect her levels of depression and disturbed sleep pattern. Additional testings of her lungs and oxygenation levels, along with a review of her current medication levels, needs to be completed in order for her to find the cause of her symptoms. First-line non-pharmacological therapy for an individual suffering from disturbed sleep patterns includes sleep hygiene and/or a sleep diary. Patients are advised to remove underlying factors that could be affecting their sleep, such as caffeine, stimuli, even before bed, and are encouraged to exercise regularly, take medications, stretch, and maintain constant wake-up times. The final issue of concern for Mary is her joint pain. A review of her medications would be needed to reduce her symptoms and establish an adequate dose combined with soft exercise to reduce impact on joints. Lastly, a review of all medications is needed to inform and control her asthma and joint pain. Confirming fluoxetine is correct to her age and weight, and the potential side effects of diclofenac is also essential. Potential drug interactions needs to be revised, along with removing St. John's wort for 2 weeks to rule out the possibility that it's causing Mary's side effects.
As highlighted above, Mary is not receiving the desired therapeutic relief from her current medication. This is attributed to inappropriately prescribed medications. Mary has been suffering from increasingly negative thoughts, and this issue has been compounded by the extra stress of a new work-home arrangements and the addition of fluoxetine to a medication regime. In addition to the side effects of anxiety and insomnia, fluoxetine in combination with St. John's wort may result in serotonin syndrome. This suggests that Mary is experiencing the adverse effects of the drug interaction due to the recent behavioural changes. Due to Mary's degrading mental well-being, it is recommended that Mary discontinue St. John's wort from her medication. Patients are advised to discontinue St. John's wort 2 weeks prior to starting fluoxetine. The patient has been advising of additional required usages of a subbutyral inhaler and the worsening symptoms of asthma. This suggests that the patient may not be receiving the required relief from the subbutyral, therefore a reassessment of the patient may be required. In addition to the patient's excess use of subbutyral, this carries the potential to exacerbate her asthma symptoms. Therefore, it is recommended that the patient receive additional support and education regarding her medications.
The therapeutic plan devised for Mary will incorporate other healthcare professionals such as a psychologist, dietitian, physiotherapist, and a general practitioner to assist Mary with her general health and well-being. Mary's general practitioner is vital for a therapeutic plan to treat her medical conditions. A general practitioner can monitor and manage Mary's medication so that appropriate and beneficial medications are being prescribed, but also can coordinate referrals between Mary's healthcare team when necessary. A psychologist would assist Mary in her overall healthcare plan by providing mental and behavioural coping mechanisms regarding Mary's depression and stress levels. The psychologist can assist Mary by reducing her emotional distress and promoting achievable stress management strategies. Mary's recently lost 4 kilos in a month and would benefit from the input of a dietitian into a therapeutic plan. A dietitian can assess Mary's current nutritional status and develop a diet plan that encourages a balanced diet. A dietitian can include a diet plan to enhance her energy levels and promote her general health. With a diagnosis that includes asthma and joint pain, Mary needs physiotherapy to help increase her oxygenation levels whilst including low-impact exercises. Breathing exercises can be implemented by the physiotherapist to assist with Mary's asthma, and incorporating low-impact exercises will not cause her harm with her joint pain. Ultimately, Mary would benefit from a holistic approach that incorporates non-pharmacological and pharmacological strategies to assist with her physical and emotional well-being. It is also suggested that the patient receives additional support and education regarding best therapeutic practice.
Thank you.